Hello, thank you for reaching out to us and you're interested in upper cervical care. My name is Dr. Gertner from Upper Cervical Chiropractic, and we perform an advanced chiropractic procedure that provides permanent relief to some of the most severe spine-related conditions. The procedure is safe and gentle, and half our patients get immediate relief. Just a 15-minute exam will determine if you are a candidate for care. So before we get started, I'll take just a few minutes to explain how we're different, and in order to understand that, you should first understand how the body works, how the body breaks down and does their work, why people have different symptoms and conditions, why traditional therapy, chiropractic medicine may not help you, and why this procedure called the nuclear correction very likely will. I like to make things very simple so everyone can understand it. We start off by the first organ in the head that controls all the other organs. That, of course, is your brain. And what happens is the brain sends energy and electricity down the spinal cord. Your spinal cord acts like a river carrying energy from the brain, down the spine, out the nerves, to all the organs, tissues, and muscles. And each and every organ is totally dependent on this energy that keeps us all alive and healthy. Because the brain and spinal cord is so important, that's your central nervous system, it's all surrounded by bone. So the way we're all created, it's all surrounded by bone, and the skull protects the brain. The rest of the vertebrae look like this. And these are bones that surround and protect the spinal cord. Its job is to insulate the nervous system, provide 100% function of the nervous system, which is optimal health. And each bone sits one on top of the other. As long as they're perfectly straight and upright, its job is to insulate and protect, allow for normal function. If you have an accident or injury or fall, what happens, the spine breaks down, it twists, gets stuck in a stress position, and instead of protecting the nervous system, it actually causes injury to the nervous system. And the nerves, which are skinny, perfect nerves like this, get pinched, fat, and inflamed like that. That's called subluxation. What happens, like a dimmer switch, like turning the energy down here, the energy can't get through the nerves to the organs, and all the organs progressively weaken, degenerate, over time can lead to disease. Half the nerves go to organs, the other half go to muscles. It's the motor nerves that control muscles, and if they're pinched or subluxated, you can have weakness, tightness, spasm, fatigue, numbness, or pain. And the reason why I leave pain for last is only 10% of these nerves even cause pain. Most subluxations have little to do with pain, but by the time you have any pain, your nerves are inflamed and your body's in crisis, but it's not to the very end stage of subluxation before any pain begins to occur. When most people have a health issue, the first thing they do, they ignore it, they hope it goes away. So you wake up with pain or some digestive problems or some type of sickness, you ignore it and hope it goes away, and sometimes it does, but it almost always comes back. Then you take medication off the shelf, something over the counter such as aspirin or Tylenol or Aleve or something like that to make you feel better. And sometimes that does take the edge off, makes you feel a little bit better, but it doesn't fix the problem. Then people get more concerned, they start Googling it and they find out they could be something more serious, so they visit the medical doctor. And the medical doctor gives you pills or potions or lotions, injections, needles or creams, and they give you meds to make you feel better, and they do their job, they make you feel better, but the problem is, it doesn't fix the root cause of the problem, it doesn't fix it permanently. That's why you have to keep taking medication for long periods of time. So the medication also limited and temporary. A lot of my patients, before they come and see us, they've already seen traditional chiropractors as well. And there's nothing wrong with regular chiropractic, I don't want to take that at all, because I have a lot of friends that do regular chiropractic that do great work and they do help a lot of people, but we deal with a lot of severe cases that don't get better through regular chiropractic when they come in here, and this is very different. You'll understand why in just a few minutes. If you understand the structure of the spine, this will make a lot of sense. Each vertebra has a disc between them, and these discs, like this, perform two functions. It acts like a shock absorber, protects that area, but it also limits the range of motion. So you can have direct trauma to your spine from an accident of some sort, but these vertebrae will only misalign a very small amount. You can have a compensation to the spine in these areas, that's what it's called, a very small misalignment. You might have some actual symptoms here. You can adjust these areas using regular chiropractic, and you might feel good temporarily, but the problem is these slight misalignments are not the real source of the problem. The two top bones in the neck are called the atlas and the axis. They're unique to the rest of the spine in that there's no disc above or below. And that's by design, so you can turn your head left and right easily like that. But the consequence of not having a disc, these areas are not protected. So you can have an injury, and instead of a small misalignment of say half a degree or so, this can misalign up to 15 degrees. So that's the only true subluxation. The rest are just minor compensations. This is the only true subluxation, and when you correct the atlas back to normal, it will definitely help with some upper cervical issues, but help provide stability all the way down the spine. So even the most lower lumbar regions. So even severe low back pain, where regular chiropractic may not help, can be helped here. So through the nuclear procedure, we provide permanent relief to some of the most severe spine-related conditions. If you have any additional questions or want to schedule a consultation with myself or one of the doctors, feel free to give us a call at 686-6200. Again, my name is Dr. Gertner from Upper Cervical Chiropractic. We love to help.